Hey, hi, mommies. Thank you for joining in. We'll just wait for our expert to join. So we are just waiting for our expert to join in. Stay with us. There we go. There we have.
Yeah.
Hi.
Hello, good evening.
Good evening. So let's begin our evening for today. So as we all
Yeah,
know,
definitely.
pregnancy is such a phase that has its own excitement and fear at the same time. Yes, ladies, I am talking about one of the phase that every mother goes through, the fear of labor and childbirth. Have you ever thought who creates this? Who starts with this fear? The moment we become pregnant, there are so many stories all around that we start listening to. Some of them, my sister, she just faced 24 hours of labor. My friend, she torn her sister-in-law's blouse during her contraction, and many more such stories. Trust me, it's not easy for a new mother, at least for the ones who are the first timers. It is fearful. So today, our session is going to be very exciting and very informative with our own expert, Dr. Rashmi Pa. So,
Hello, everyone.
so Rashmi, she is a senior consultant therapist for antenatal care, lactation consultant, and childbirth educator from Kappa. She is founder and director at Wellmom. She has been guiding women right from pregnancy to childbirth to breastfeeding to early child care from last 2 decades. So a very warm welcome to Rashmi, who will be guiding us on how we cannot remove this fear, but at least we can just make it a little less fearful for everyone around. So Rashmi,
Yeah, of course.
a very warm welcome on our platform today.
Thank you, Nisha. It was a very sweet introduction that you have just
Thank you
given.
so much.
And yes, labor is a topic which actually scares everyone. But let me tell you, knowledge is half the battle won.
I agree with you.
You just have to be prepared mentally as well as physically, and things fall into place. Of
Right.
course, the two stories that you just shared, especially tearing the garments and all, of course, this happens. But yes, if you know some techniques, then things are a little easy on you. And yes, thoda bahut to we all have the luxury when you are in labor, you can do whatever you want. You are the queen.
Exactly. So Rashmi, tell us some of the experiences that you have. What is the most common fear or the thing that mothers comes to you with?
Nisha, it is more the fear of the unknown.
Okay.
Fine, because see, it is actually, I feel very bad when I say this, but what happens is the way labor has been presented to us through whatever info that is floating around, be it those movies or the TV shows, या जो कहते हैं दूसरा जन्म होता है, all those things have been, I believe they all scare everyone. Fine. I am yet to hear anything which is very positive about labor. Very happy. And Nisha, what happens is generally when we are conducting the sessions also, one of my favorite questions is that what is the first thing that comes to your mind when I say labor? And I'm from the past 20 fun years, I believe, I am yet to hear anybody to say the baby. Everybody says pain, dard hoga ma'am, contractions hongi. I
Right.
mean, the mindset is very different.
Agree.
We
Agree.
just have to work on that, I believe.
Right. So to begin with today, as I also did my research, there are some of the very common fear which normally mothers come across. So let me pick up one by one. The first one that, of course, you also mentioned, the fear of pain, the fear of contractions. So how
Yeah.
do we deal with that, and how a mother can overcome it?
Yeah. Sinisha, labor is one examination जिसमें आप overnight पढ़कर you cannot perform.
Of course.
You just have to prepare yourself throughout pregnancy at whatever stage of pregnancy you are. Don't be disheartened if you're hearing this and you are in the ninth month of pregnancy. Wherever you are, you can start with your preparation of labor. Fine, gain knowledge, but please don't trust only Google to give you knowledge.
That's
गूगल में फिर बाइस जाता है. You should be talking to medical professionals.
right.
You should be talking to educators who are there for you, and to get uh, a very first-hand view of what exactly labor is. These days, we have loads of techniques. So, if you are doing the breathing exercises, the relaxation exercises, if you know that yes, pain will be there, but these are the things which are going to help me with the pain at that point of time,
Right.
then yes, this fear of pain is taken care of.
Agree. The next one in the line is fear of fainting and blood loss.
See, fainting and blood loss, ये बहुत common नहीं है, girls. This generally happens in the movies. So it's
Agree.
okay. You just have to be prepared. Fine. And yes, just in case anything happens, then the medical professionals are there with you in this journey. You are just not alone. So instead of fearing for that, maybe just being positive and just getting positive vibes around you will help you more.
Right.
Anything can happen in labor, agreed, but that can happen in any other thing also. You just have to be at a good setup, you have to trust your doctor, and everything is going to fall in place.
Right. And the next one is fear of interventions during labor.
Okay, interventions. See, nobody is ready with all the equipment to give you the interventions. Believe me, nobody is. Interventions are done only when it is essential. So, like I said, if you trust your doctor, you know that yes, if the intervention is being done, in case it is needed, fine, it is done for the health of your baby and yourself. So, it's okay even if there are any medical interventions done at the point of labor, if at the end of everything you have a happy smiling baby in your hands, then I think everything will be taken
Everything
care of.
taken care of. Right.
You know, at the end, you just have to have your happy, healthy baby and a smile on your face. That is all matters.
Right. If end is well, everything is well.
Exactly. So things can happen. I'm
Right.
not saying that things don't happen, but if these are needed, if these are needed for the health of your child, for your health, then of course these decisions need to be taken. There is no point fighting against. At times, we have instances here in the labor room that when some intervention is advised, fine, the family is very much against it. I
Right.
think something has
Uh,
happened.
yeah,
Um,
just your screen went blank. Yes.
yeah. Okay. I think we are playing. And labor is happening here also with the brightness, I believe.
Right.
Okay. So we'll let it happen. We'll see how it goes. So, anyways, like I was saying, that when doctors advise something medically,
Right.
there should not be any resistance from the family also. This is one thing that we as medical professionals also expect from the family.
Right.
Fine,
Right.
it should go smoothly. There are certain things which should be done at a particular time only. If we lose that time, then of course things go the other way around.
Right.
So everything should be discussed in your prenatal visits. Everything should be discussed. If you have any apprehensions, even that should be taken care of, and then one should go ahead.
Right. So the next one is fear of not being in control. I
Yes.
think this is one of the most
Fear of not being in control. Yes. See, this happens when instead of focusing on labor, one is focusing on everything around labor. Fine. If you spend some time with yourself during the day, if you chalk out a map for yourself, if you have a birthing plan, fine, then you can be one with the team. It is not about who is in control. It
Mhm.
is about who is in the team.
Okay.
Teamwork always wins. So
Right.
it is always better to talk to your medical professionals and then go forward with this. I
Right.
think my video is frozen here.
I
There is
can
something.
hear you, but I think the video is frozen.
Okay, then
This might be
maybe I
some
can
network
join
issue.
back. Okay, nahi, network to here is fine. I'll join back with you, I believe.
Okay.
Yeah,
So, Mamas, just
just a
stay
minute.
with us. Rashmi will be joining us in a minute.
Yeah, I think it's better now.
Better, right. So, as you have
See,
already
labor
mentioned,
perception wins here also, I believe.
right.
Yeah.
Yeah. So as you have already mentioned, the way around people portray the labor phase of our life is like horrible in movies, in stories, everywhere around. They portray childbirth as the most horrible and the painful event of a life.
Yeah,
But that's
they do.
not true. Some part of childbirth is intense, it is painful, agree. But there are other stages of birthing process as you already mentioned it. And also, as we always mention, education is the key. So the more we understand about the process, the more we talk about the process, we discuss it with our experts, we take guidance, it becomes easier.
It
So
does. It really does.
not taking much of the time, I would like to just start with this thing, Rashmi, make mothers understand exactly what is labor. So when we are talking about the term labor, so what is it and how a mother can understand that she is about to begin the labor?
Okay. See, labor is essentially the process of childbirth.
Right.
Fine. Right from the first contraction to the delivery of the placenta. Fine. It doesn't end with the delivery of the child. Till the delivery of the placenta, we consider it as labor. Fine. And I think you asked me how would one know?
Yes, that
What was the second one?
they have begin with the labor, or they are about to
Oh,
begin with their labor process.
okay, okay. Believe me, you will know. See, what happens is there are some very subtle signs of labor, which we generally miss. One of those is when you have this great burst of energy. You are bubbling with energy. You have this nesting instinct in you. You must have heard from the nannies and dadis around कि हमने 2 बाल्टी कपड़े धोकर हम चाइल्ड बर्थ के लिए गए थे.
Right.
All those things, that burst of energy is one of my pointers to that labor is very near. Then, of course, mild contractions, which cannot be missed. Fine. When labor starts, there are mild contractions. There is a lot of pressure, which a downward pressure, which the baby is exerting, backache. Some of the females have diarrhea because the hormone relaxin, no, that is released into the body, and even the muscles around the bowel movements, even they are relaxed. So you have diarrhea also. All these are very subtle signs of labor. But one of the very major signs, of course, would be the loss of mucus plug or the water breaking. Fine. When I say water breaking, generally perception होता है that yes, you will be in a pool of water or it'll be a pop and yes, water all around. In just a handful of cases, that also happens. But majorly, it is more about a trickle down of water.
Okay.
Fine, just like the menstrual flow.
Oh,
You'll have some cramps and the water will trickle down. This is another sign that yes, labor is very near.
yeah, right. So, Rashmi, as you just mentioned about contractions, right? So there are many kind of contraction. In fact, one of them is something called as false contraction or false labor. What is that
Yeah.
all about, and how a mother comes to know whether it's real or a false one?
Okay. False contraction are the ones which generally people experience when they come with all their hospital bags at 2 at the night and then they are sent back. So bringing
Right.
them back to that is a very common thing that happens. Fine.
Okay.
See, these false contraction or the Braxton and Hicks contractions, as we call them, are majorly practice contractions, like we just call them practice contractions. Fine. They are not the true ones. The true contractions are the ones which would end once the baby is delivered.
Okay.
Fine. In case of true contractions, the major demarcating factor here is that they are rhythmic contractions. Fine. If we just draw a graph, if we are just measuring each and every contraction, then in case of true contractions, we can see a pattern forming that contractions are getting lengthier and the time frame between two contractions is getting shorter. So this is one of the ways wherein one can distinguish that the contractions she is facing are the true ones or the false ones.
Right.
Another very simple way to demarcate between a true and a false contraction again would be to change your position. Fine. If you notice that yes, something is happening, some peculiar kind of a spasm or a tightness is engulfing you and then receding, fine. Try to change your position when you are in the mid of that particular contraction.
Oh,
If the contraction goes unchanged, it reaches a peak and then it goes down, fine, then that's a true contraction. But in case it ends very abruptly where you change the position, then it is not at all a true contraction. Then that's a false one.
so
Right?
Rashmi, help me understand what exactly a mother should be expecting during her labor times.
Okay. The mother, first I'll say what not to expect. Fine, because if we expect that yes, everybody will be calm around us when we are in labor and all smiles around, that you're not gonna get. Everybody will be thoda sa impatient because that is what happens during labor.
Right.
But again, we would like that yes, everybody is very calm and patient with. And yes, now coming to your question, what one should expect when one is in labor, fine. See, first and foremost, what one should expect is that contractions are going to come. They're going to follow their course. A contraction is more like a wave, I should say. A
Okay.
wave will be engulfing the abdomen and then it will be receding. Fine. Then, after some time, again that wave will be coming and that will be receding. As the time passes, fine. When the contractions are true, then of course we have cervical dilation along with that. 1 centimeter, rather 0 centimeter to 10 centimeter is what we call the path of labor. Fine.
Okay.
So till this thing, the contractions will come and go, come and go, come and go. Then they'll become more intense and you'll be doing your exercises, the techniques that we teach you throughout pregnancy, the preparation of labor that we have with you. And then, of course, you'll have your beautiful bundle of joy with you. That is what labor in a nutshell is.
Right. So the most important thing you should be expecting is a bundle of joy in your hands in the
Yes.
end. That's it.
Yes, you got the gist of it, no?
So Rashmi, tell me one thing. As you just said earlier, also you mentioned this thing. How early a mother can start learning or understanding or talking about labor? Is it only for the
And
last trimester, or they can start from the first trimester?
no, 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 no. Whenever you come to know you are pregnant, or I would say when you start even thinking about conceiving the baby, when you plan the baby, I always tell everybody that you are parents the moment you take this decision to bring the baby into the world, no?
Right,
So the preparation, the mental setting or the mindset, I should say, should start from day one. So
right.
whatever stage you are in, you should start your preparation from that very point. It is very essential. The earlier, the better, of
The
course.
earlier the better. Correct, correct. The
Yeah.
last one is, in the last decades, we have heard of different procedures. There are so many of them, like hypnobirthing, water birthing, and few more. So please help me understand how safe they are and how can a mother be benefited from it.
Okay. Nisha, let us understand one that if a particular procedure is being given a green signal by the medical associations,
Right.
then it is a safe procedure.
Okay.
Fine. Had it been an unsafe procedure, then of course it would not be allowed in the hospitals. That is one thing we all should understand very clearly before we get into any debates about anything.
Right.
Fine. Each and every new kind of an intervention or a procedure, when it comes to us, we all have our questions. The procedure becomes safer if you know about it thoroughly,
Right.
if you talk to your practitioner about it. So, if you want to go for a water birth, or if a water birth is offered to you, it is a wonderful kind of a birth, let me tell you that. Then, in order to be very sure, you should talk to your practitioner, you should visit the facility, find, you should see how things are being done, and then you should always go ahead with it. That is the best kind of preparation that you can do rather than going in for all the media things to tell you more about a procedure. Talk to the person who's going to perform it to you. That is very important.
We should not be believing on only on movies and the Google.
Very true, very
Definitely
true.
ask our experts to guide us.
Yeah, of course. Because the experts would know a little more than any other person would.
Of course. Of course, of
Fine.
course.
That
So,
matters.
so moving with the evening, Rashmi, the day we have posted about this topic on the platform, there are a lot of mothers who have approached us with lot many
Wow.
questions. So I'll start taking up one by one. The first which
Please.
came to us is, if I'm prepared, will I have normal delivery only?
Okay. See, no one in the world can guarantee a normal vaginal delivery. And one more thing, all deliveries are normal. Even cesareans are normal. It is not that only a vaginal delivery is normal. Fine. So, ये जो एक taboo है, I think we should all be breaking that also. All deliveries are normal as far as the baby is healthy and the mother is healthy. But yes, if we are specifically talking about vaginal deliveries, preparation helps. Fine. The exercises, the mental preparation, it all prepares you for a normal vaginal delivery. Fine. But yes, it doesn't guarantee anything. There can be certain complications, and you might end up with a cesarean. What matters is that mentally you should be prepared for all the scenarios.
Right.
You try. If it's a vaginal delivery, wonderful. If it's a cesarean, wonderful again.
Okay. So moving on with the next, where to find the help and whom to ask for
I
labor
couldn't
guidance.
get this question. Please repeat.
Where to find help and whom to ask for labor guidance.
Okay. Like I already said, talk to the person who is going to perform the procedure for you. Fine. And yes, in all hospitals these days, we have specific childbirth classes going on. The team at that particular hospital is the best team to ask questions, to clear your doubts about anything. Try to attend some prenatal classes, which are wonderful for you. Fine, these are things that take care of all your doubts and apprehensions.
So this is mother. She was very apprehensive about this. Like, who should be my birth partner? And who is the best
Okay.
birth partner?
I love this question. I love this question. See, what happens is there is a general profession, general perception that only husband should be the birthing
Right.
partner. But please, girls, when you go ahead and decide your birthing partner, just make sure that that partner is very much patient. Fine. She knows how to handle herself or himself. Fine.
Right.
We would like to have a very calm and patient person who can just guide you through labor. If we have the husbands fainting there in the labor room
I
before the
was about to say, because even during my second one, I was asked and I said no. Because I was like,
yeah,
let me be in the center point where everyone is taking care of me and not of my husband at that place. So
it
there
happens
should
many a times. Yeah, so anybody
right,
who can support you, who can hold your hand through that particular beautiful phase is the one anybody who loves you a lot, who can
right.
see you in this
That
discomfort,
phase,
but
right.
yes, she is the best birthing partner for you.
Yes. So it can be anyone, not only your husband, but it can be your
Yeah.
doctor, your educator, your
Yeah.
friend, your mom, your mother-in-law, anyone.
Anyone
Right.
whosoever gives you strength at that point of time,
Exactly.
that person should be your birthing partner.
The next one is, what should I do if I'm afraid of childbirth?
Talk about it. Talk to people around. Fine. Go ahead. Clear your doubts. Talk to your practitioners. Do some meditations. Do some relaxations. And yes, when you close your eyes, you should always see a happy, smiling baby. That will take care of everything. You
Right.
don't have to be afraid of childbirth, girls, because see, from times immemorial, birthing is there. It is the most natural process. Fine. So, no point to be very afraid. Just think about those old times. Then though we didn't even have the kind of medical things we have these days, the advancements that we have these days, fine. And at that point of RHB, we have in the villages, people deliver naturally. So it is okay. It's a very natural phase of life. Just let it be that. Don't complicate it. Just enjoy this phase.
Again, the next one that is coming is really, will the pain be too much for me to manage?
Pain will be there, agreed, definitely will be there, but it is not something that cannot be managed.
Right.
You should know how to manage. Like I said, in this exam, preparation helps. So understand the pain, understand positions, understand what is going to help you in labor, do the breathing exercises. Just seeing somebody do a breathing exercise and then just thinking that yes, this is very easy, we can do that in labor, no, that is not going to help. You have to practice till it becomes a habit with you. Then
Okay.
yes, pain is manageable, things can be managed very beautifully. We have smiling girls coming out of the labor room, so it is all good, no issues.
So the next one is, how to deal with emergency C-section.
Okay. See, if an emergency C-section has been performed, fine. In a planned C-sec, of course, we have the things in place, fine. You know that you are expecting that. But in case of an emergency C-sec, the best thing to deal with it is to take rest afterwards. Just rest your mind, be mentally very, very stable, accept that yes, this is something which was very much needed. Take all the help which is around you, and you'll definitely come out of that. It's okay. Especially in the emergency C6, what troubles us more is the guilt that one has. I tried for a vaginal delivery, but I could not do that, and I had to go ahead with the cesarean. It has nothing to do with you.
Trust me, my
Just
next
understand
question,
that.
my next question is just around this. A mother just like she shared this thing. Will I miss? Bonding opportunities if I have a baby delivered by C-section.
Ah, that is something which we come across very, very normally. See, what happens is in case of a planned cesarean or in case of a normal vaginal delivery, we know that yes, we'll be bringing the child to you very soon and everything will be in
Right.
place. But even after an emergency C-section, fine. If you have been given local anesthesia, then that's fine. But in case of a general anesthesia, definitely some amount of time you will not be very close to the child,
Right.
right? But believe me, the bonding is never late. Whenever you start, the bonding is gonna be there.
Right.
The sooner you start breastfeeding, the bonding will be very much there. Fine. So try to keep the baby as close to yourself whenever you can afford doing so. Fine. Rooming in is one of the things which is very, very important here. Fine. You can always give baby good amount of skin to skin contact, and yes, the bonding will definitely be there. It is not only at birth that the bonding has to happen, it is an ongoing procedure. Fine. Even as after some vaginal births, we see a delayed bonding with the child. Fine. It comes naturally to you.
Actually.
So
Right.
it's okay. Fine. Bonding will not be affected.
Right. So my next question to you is, how long does labor last?
See, length of labor is very, very individualistic. Fine, you cannot have the same yardstick for everybody. A common predictor would be how your mother had her pregnancy. Fine, a girl's pregnancy or labor is very much, very close to the kind of labor her mother had. That is one thing. Otherwise, if we go ahead with a very wide average, fine. So it is somewhere between, say, 12 to 24 hours that a normal labor lasts. But again, seeing your expressions, don't think it will all be painful. Fine. It is just a very small part, the active
Right.
part of labor, which is that painful part. Otherwise, initially, you won't even recognize that the contractions you are having are the labor contractions.
Correct.
Fine.
So
Yeah,
the next one is, what to do if the baby bag burst when I'm at home only.
it's okay. In case that happens, no, first of all, you have to ascertain that this is the baby bag which has burst. Because in the later part of pregnancy, it is very common to lose some drops of urine also. Fine, you might sneeze, you might do some activity, and you might lose some drops of urine also. So you should ideally smell the kind of discharge that is happening. If it is a fruity kind of a discharge, it is generally the amniotic fluid. Fine. And then if you are very sure that yes, this is the water bag which is bursting, fine. If it is just a tickle down and you're not sure, then you need to go with this smelly bar. Then, of course, if you're very sure, then wear a thick pad, a certain what is the color of the discharge which is coming out. Fine, if it is a bloody discharge here, yeah, if it is a browning discharge. These are the things that you should jot down, especially the time when the water bag had burst, and you should reach the hospital.
As soon as
All this particular information about the color and the time of the discharge should be shared with the staff there so that a timely decision can be taken on things.
okay. So just to understand, even there is one this question also. Will my contraction starts the minute my water breaks?
No, not essentially.
Okay.
Fine. Generally, contractions come first and then the water bag breaks. Fine. But in case if the water bag has burst, the contractions will be there after some time, but not at that particular
Not
moment. We
immediately.
cannot expect that. No, no, it doesn't happen that way.
Okay.
That is why people are in this dilemma whether this is the amniotic fluid which is oozing out or it is something else, right?
So there's this mother who's asking, if I have wide hip, it's easier to labor.
This is a perception which is going around for ages now.
Right.
But see, when we talk about a wide hip, it is more because of the ilium or the bone which is growing laterally. Fine. But what affects labor is the size of the opening, the pelvic inlet.
Right.
And of course, which is more important is the position and the size of the baby. So the wide hip is not the only criteria which I would be going ahead with here. Right?
So the next one is castor oil and spicy food send you into labor.
It doesn't send you into labor. Actually, there are a varied number of theories around it. Fine. Yes, in some cases, labor does precipitate after taking castor oil or spices, but we are not sure that it is a direct result of that castor oil or spices only.
Okay.
It does irritate the intestines. So might be when the when the intestines are irritated, the uteric muscles are also stimulated and they get into contractions. But we have no very direct theories to prove this thing.
Right. So the next one is second labor will always be less painful.
See, the contractions are the same. Fine. What changes here is the knowledge that you already have about labor. So that actually validates the fact that the knowledge of labor is very, very important.
Experience
How
matters.
you, yes, how you take those contractions, find the mindset changes. So second labor is of course easy on you. And yes, it is shorter. That is there.
Right. So the last one for the evening. Once you have a cesarean, you cannot give birth normally, vaginally.
No, VBAC is a validated thing. Fine. It is basically what makes the difference is why you had the first cesarean in the first place. Fine. If it was because of factors which were concerning the baby, fine, then of course a VBAC is very much possible. Okay. But in case it was because of some factors, some bony problems with the mother or anything else, then it would be a problem. So it is again a very individualistic decision which can be taken by your practitioner. But yes, one thing is very, very sure. If you are attempting for a normal delivery after a cesarean birth, it should be attempted in a good setup.
Okay.
Fine, that is something I would stress on, but it is very much possible.
Is it right? So as we are almost on the end of our session for today, I would definitely like to mention this thing that women are strong, women are courageous, women are capable. But
Very
even
true.
the most confident and the fearless among us are bound to get at least a little nervous as they are nearing to the reality of giving birth. But trust me, mothers, all you need to do is enjoy that phase. Leave all your stress with your experts. Let them guide you, let them help you. And you have to
Yes,
wait only for the bundle of joy that is going to come after all this pain.
very true, Nisha. Just go with the flow is something which is very important.
Yes.
Just relax. Just do whatever you want to do. Just enjoy this phase as any other phase in life. And the outcome is really going to be beautiful.
Definitely, definitely. So thank you so much, Rashmi, for taking out time for us, guiding our moms, and giving them the strength and right direction.
Thank you so much. It
Thank you
is
so
always
much.
a pleasure connecting with you.
Yes, ma'am.
Thank you.
Thank you so much. Have a nice evening. Thank you,
Thank you.
mommies,
Wishing
for joining
everyone
us.
happy healthy pregnancies. Bye bye.
Thank
Take
you.
care.
Bye.